A modified low FODMAP diet is actually really useful in clinical practice. It's very much up to the dietitian to decide what's going to be appropriate for each patient, and not every patient is the same. I would certainly not use the whole FODMAP diet for every single patient. I have, for instance, some patients, particularly my elderly patients, who may find it extremely difficult to do the entire FODMAP diet. But for them, there are certain foods that you can see very clearly are the real problems, and therefore it's not necessary to take everything out. So some of my elderly patients, particularly where I work down in Somerset, have allotments, for instance, and they grow lots of their own vegetables, and they have fruit trees, and you know that actually they're taking in a lot of fruit and vegetables that are high in FODMAP. And if we simply reduce those down, we can actually get on top of the symptoms, and they never need to do any other aspects of the FODMAP diet. Equally, we get some patients, perhaps the younger cohort sometimes, for whom they eat a lot of wheat. They have a lot of wheat in their diet. They're out working every day. They're grabbing sandwiches at lunch and they have pizza for dinner. They're having wheat bits for breakfast, and they're having a large proportion of wheat in their diet. And for them, simply lowering that wheat content can make a huge difference. So there are definitely situations where I would say a modified FODMAP diet is extremely useful, and equally times where I have a patient that unless we do the entire FODMAP diet, we're not going to get the results we're looking for. So it's really down to clinical judgment as a dietitian, and that's probably why having a dietitian involved is so important. I would say the ones that we use a modified FODMAP diet, majority do see improvements. You've got to gauge it, because with irritable bowel syndrome, you're never going to get to a state of no symptoms at all. That would be really rare. What you're doing is reducing the symptoms to improve their quality of life. So with some of those patients, you are definitely seeing an improvement, and it's enough to make a huge difference to their quality of life. But it may not be perfection, but they're happy with that. And you've got to judge it as to whether you think it would be realistic for that patient to actually say, okay, you're 70% better, now let's go really strict with the whole FODMAP diet. It may not be suitable for them. And so, yes, we definitely see success with modified FODMAP diet. And you've really got to look at it and see which bits of the FODMAP diet you're going to use for that particular patient.